Hey guys, so this is a quick recording of the respiratory lecture from today, due to the projector being garbage. It did get fixed though, so once again, guys, I apologize for that. Just technology doesn't cooperate sometimes, and you have to just kind of figure stuff out. So, um, there we go. So I will share my screen, and then we will get going here. Hope you guys are having a fairly good Monday. Come on. There we go. All right. Pardon me. So, sorry, guys, one second. There we go. Okay. Sorry, it opened up some weird version. All right. Okay, here we go. Finally. Okay, so the respiratory system, guys, like we talked about, as I did my best to teach you from an anatomical model today, right? The respiratory system itself, as we know it, right, starts essentially at the nose. So obviously, as air is inhaled or inspired, right, the respiratory system travels through those turbinate bones that I showed you in class, and that essentially warms and moistens the air, right? That air then travels out, through the oropharynx into the trachea, right, which is essentially the tube that connects the oropharynx or the nose and mouth right to the lungs. So what we can see obviously here is that obviously the trachea is essentially made out of cartilage, and that actually one thing that the trachea does contain is it actually contains cilia, which are little hair-like projections that actually assist in the movement of mucus and fluid, right, throughout the respiratory system and the respiratory tract. It is commonly known, right, that smoking actually paralyzes those cilia and can make obviously um, expectoration of mucus and that kind of thing extremely difficult. Okay, so obviously, guys, the opening into the trachea, we have the vocal folds here, right? And so the vocal folds, as you can see, right, essentially create what we call the vocal cords, right? So ultimately, we have the epiglottis at the most posterior aspect, right, um, of the um, of the opening to the trachea, right? That actually essentially closes the digestive tract, the back of the throat, when we take a big deep breath in, right? So the glottis itself is actually the opening to the trachea, right? And so the vocal cords open and close as we inhale and exhale. Now, one thing to keep in mind is there is a condition known as vocal cord dysfunction. I actually have this, where when you actually take a deep breath in, the cords move paradoxically. So when you take a deep breath in, they're supposed to essentially open, right, so that the air can pass through. But in people that have vocal cord dysfunction, right, the cords actually move paradoxically. So they actually close on inhalation and they actually open um, on exhalation. And there are times where people with vocal cord dysfunction can have a very difficult time with exercise, particularly with aerobic exercise, because, um, excuse me, that paradoxical movement of the cords can actually inhibit um, inspiratory volume and inhibit the ability to get air into the lungs during exercise. So when we take a look, guys, at the structure of the respiratory system, we're essentially concerned with a structure that essentially runs from the trachea, right, all the way to essentially the secondary and tertiary bronchi, right? And this whole unit for including the trachea as well as the bronchus and bronchi is known as the respiratory tree, right? So for any of you that maybe go into respiratory therapy and or even go to med school and get into pulmonology, you will actually learn. As a matter of fact, you will learn all 10 lobes of the right and left lung. For our purposes, we only discussed three today: superior, middle, and inferior in class for the right, and then obviously two for the left. Um, so one thing that we talked about as well in my drawing on the board that I was actually very, very proud of myself for, right, is the alveoli. See that the alveoli, as we talked about, are surrounded by a capillary bed. And this is actually where gas exchange occurs between the arterioles and the venules, right? Um, and so this is actually where deoxygenated blood is reoxygenated and put back into pulmonary circulation for, obviously, um, recirculation through the left ventricle out to the systemic circulation again to perfuse the tissues. So we talked about in class as well the presence of the anatomy of the lungs, right? And then on the right side we have three lobes. We have a superior and inferior lobe, whereas on the left we just essentially have a superior and inferior. And the left lung, as we said in class, has a key defining anatomical landmark known as the cardiac notch. This is actually where the the left where the heart itself actually sits. So the heart itself actually sits anatomically slightly lateral to the sternum uh, and slightly left of the sternum, right? So right inside of the cardiac notch. Um, we talk about the alveoli. Okay, this is the functional unit of the lung. We can actually see, right, as we talked about in class. So we essentially have ultimately a collection of alveoli, which is an alveolar sac, but there is actually a duct, right, that actually leads directly into an alveolar sac with many alveoli. Now, once again, we have the capillary bed permeating the alveoli. This is actually where gas exchange occurs. We have both arterial and venous supply, right? The capillary bed here, which facilitates gas exchange through those loose gap junctions in the capillary. All right, terms. So we talked about in class how essentially the respiratory system in general has one of the has there are quite a bit of terms here, but what we need to know, right, is that we have five different terms for lung, right? In this unit, we have pneumato, or pneumono. That all means air or lung. Pulmono means lung, okay, as well as lobo, okay, or pleuro. So I believe that's actually six if I'm counting correctly. I think that might be six. So yeah, we have five or six different terms here that actually all mean the same thing, right? So obviously we talked about the adenoid glands. So adenoido, right, means adenoid. Naso or rhino means nose. Epiglotto, okay, epiglottis. Okay, laryngo, larynx, that's the voice box. Okay, pharyngo, that is essentially the back of the throat, right? Pharynx. Obviously, we just said lobar pleural means lung. Broncho or bronchio, okay, means bronchus. Okay, uh, pleuro means pleura. Okay, diaphragmato means diaphragm. All right, septo means septum or wall. Okay, sinus or sino. Okay, sinus. I'm sorry, sinuso or sino means sinus. Thoraco. Okay, chest. Tonsillo, tonsil. Tracheo, trachea. Right. So getting into just some combining forms here. We talked about this in class today. Uh, Atello means imperfect or incomplete. So there's a condition that we learned about in class today called atelectasis, which essentially points to incomplete expansion of the lung, right? Often due to disease such as a pneumothorax, which is air in the chest wall, or a hemothorax, which is blood in the chest wall, right? Um, so obviously hemo or hemato means blood. Okay, muco means mucus. Okay, ortho is straight. Oxo or oxalo, oxygen. Pio means pus. Okay, somno is sleep. So if you've ever had Maybe you've seen a somnographer or been and had a sleep study. You've had somnography done, right? Spiro's breath, right? So there are certain things that we use post-operatively with patients that have had joint replacements. If they are bedridden and are not ambulatory, we will at times use spirometers, right? Not only to assess expiratory function, but also to use the diaphragmatic pump, right, to prevent blood clots, right? So pretty important. All right. A few more prefixes rather. A or an means without or absent. Okay. Endo is within. U is normal or good. Okay, pan is all or total. So we said that in class that if, for example, let's say I go to the doctor because I have sinus pressure at both my frontal, right, my maxillary and my ethmoidal sinuses, I could have what's called pansinusitis, right, or inflammation of the sinuses of all of my sinuses or many of my sinuses, right? Poly means many or much, right? And then some suffixes here, which we will actually continue to kind of talk about these in more detail um, with other systems that we cover. So algia, okay, is a suffix meaning pain. Algia, pain. R or RE, okay, pertaining to. Capnia means CO2. Synthesis means to essentially aspirate fluid or pull fluid off of. Okay, you can have a thoracocentesis, might be necessary in the case of maybe a hemothorax or a pneumothorax, right? Uh, eal, which is the suffix, so eal or eal means pertaining to. Ectasis, so atelectasis, incomplete expansion. Emia, blood, okay, a condition pertaining to the blood, right? Gram is a record, okay, graphy, process of recording. Uh, Meter, so we have an oximeter, which is a device that measures oxygen content in the blood. Penia, okay, means breathing, right? Regia is rapid blood flow, right? So hemorrhage means rapid flow of blood. Generally speaking, we see this with acute bleeding. Um, okay, spasm, muscle contraction. I think that's pretty intuitive for most of us, right? Uh, and then so there is such a thing though called bronchospasm, which essentially where we can actually have spasm of the bronchus, right? There's actually some smooth muscle. Actually rings surrounding the bronchioles, okay, and that can actually uh, lead to essentially bronchospasm in people that have asthma and or people that have what's called exercise-induced bronchospasm, where they have shortness of breath that's triggered with exercise. And then we have a suffix here called stomy, which is essentially creation of an opening. Okay, so we have a thoracostomy. Okay, that's an creation of an opening in the chest, maybe to access the lungs or some other structure. Okay, so some additional terms here: bronchitis, okay, inflammation of the bronchi. Atelectasis, we talked about this in class. Okay, um, incomplete expansion. So bronchiectasis, this is essentially a condition pertaining to the bronchi. Okay, bronchogenic carcinoma, this is essentially cancer that originates in the bronchus. We talked about hemothorax and pneumothorax today in class. Okay, uh, blood in the chest wall that collapses of the lung. Pneumothorax being air in the chest wall that collapses of the lung. Okay, laryngitis, inflammation of the voice box, so to speak. Okay, lobar pneumonia. This is essentially an infectious condition of the lung parenchyma that results in inflammation of the lung. Okay, pharyngitis, sore throat. Pleuritis, which is inflammation of the covering, either surrounding the lung or the chest wall. Okay, pneumonitis, rhinitis. Okay, runny nose. Okay, inflammation of the nose or nasal passages. Rhinorrhea. Okay, it's a very angry nose. That's a joke, but it is basically nosebleed or rapid flow of blood and or even fluid, sometimes from the nose. Okay, and tonsillitis, inflammation of the tonsils. Okay, so coding of respiratory conditions obviously arises from groups J00 through J99, right? And references for today. So quick recording of today's lecture. Please reach out if you have questions. I am more than happy to review this with you if needed, right? But sorry for the projector difficulties today. Like I said, we'll be back in our normal location on Monday. And so look forward to seeing you guys then. Have a great rest of the week.